Hello everyone, my name is Jenny Rios and this is my research proposal, a randomized controlled trial comparing myoinositol and vitamin D3 supplementation for the prevention of gestational diabetes mellitus in high-risk pregnant women. So for this study, I have this research question, which is among pregnant women with at least one risk factor for gestational diabetes mellitus, does daily supplementation with 2,000 milligrams per day of myoinositol from week 12 to 35 of gestation, compared with the daily supplementation of 1,000 units per day of vitamin D3, result in graded reduction in the incidence of GDM? The null hypothesis will be that there is not a statistical significance difference in the incidence of GDM between pregnant women who receive myoinositol and vitamin D3. And the alternate hypothesis is that pregnant women who receive daily supplementation of myoinositol, they have a significantly lower incidence of GDM than those who receive daily supplementation of vitamin D3. So the objective is that this is a randomized controlled trial that determines which supplement is more effective in preventing GDM among pregnant women that has at least one risk factor. And the problem statement is that gaps remain in the literature regarding which supplements are more effective for long-term treatment of the GDM. So during this time, this is going to start at week 12 to 35, and we are going to evaluate which supplement is more effective at reducing the risk of GDM during this period. So what really we know about gestational diabetes mellitus is when is defined as a glucose intolerance that develops during pregnancy. GDM occurs when inadequate pancreatic B cell function leads to elevated glucose levels and insulin resistance. However, GDM often resolves after pregnancy, but increase the risk of developing type 2 diabetes. There are different factors for the women, which I share in this picture. And around 14% of the pregnant women worldwide present GDM, and the incidence of this diagnosis has been increasing during these years. That's why I'm showing you this graph where you can compare how much has been increasing, especially when moms are getting like older. They are more propense to develop GDM, and data from the International Diabetes Federation in 2019 mentioned that 16% of the newborns present with hyperglycemia, and 1 in 6 newborns were affected due to the GDM. So why am using myoinositol and vitamin D3 for the prevention of GDM? Well, different systematic reviews and meta-analysis investigate the effect of myoinositol supplementation compared with placebo on the prevention of GDM and demonstrate significant reduction in the insulin levels in pregnant women, as well in preterm birth and neonatal hypoglycemia. Controlled clinical trials have shown that vitamin D3 supplementation at the dose of 1,000 units daily for 8 weeks in pregnant women reduce glycemic levels and increase the serum vitamin D3 levels, reducing the incidence of GDM. So GDM can be a screen for 24 to 28 weeks of gestation. During the second trimester, glucose levels rise, increasing insulin resistance. That's why by those weeks, the test used to detect GDM is OGTT, which is where the plasma glucose levels below 140 milligrams are considered normal, and levels between 140 and 199 indicates impaired glucose. which can be a little problem. And levels over 200 or higher indicate diabetes. The etiology of GDM can be multifactional, which with risk factors, including a history of GDM, maternal age higher than 35 years, family history of diabetes, high body mass index in pre-pregnancy, metabolic syndrome, poor diet, lack of physical activity. And the recommendation to prevent GDM is to maintain a normal BMI before pregnancy, a balanced diet, and do physical activity. So using all the information that we have for evidence of myo-inositol and the prevention of GDM, studies in pregnant women at high risk for GDM found that myo-inositol supplementation may reduce this incidence. Different research show that 2,000 milligrams per day of myo-inositol was associated with fewer GDM cases compared with placebo. It shows that a p-value of 0.06. Other studies using 1,000 milligrams twice daily reported improved glucose control, reduced insulin resistance, and lower insulin requirements. Additionally, lower neonatal birth weight compared with controls. It was proven thus research evidence suggests that myo-inositol may improve insulin sensitivity and glucose regulation. So now talking about the evidence of vitamin D3, it shows that improved insulin sensitivity and glucose tolerance. Studies have evaluated doses ranging from 400 to 5,000 per day, and higher doses of vitamin D3 increase serum 25-hydroxyl vitamin D concentration, and some studies report fewer cases of GDM with the vitamin D3. However, results have been inconsistent. A study comparing 1,000 units per day of vitamin D3, it shows that 25 cases didn't get, they didn't develop the GDM. And when doses were higher, the cases, the reduction was only 15 cases that women didn't develop the GDM. So higher intake of vitamin D3 doesn't have like a statistically significant because the p-value was 0.15. So this is my research proposal timeline where participants are going to be selected before the 12 weeks, and they are going to receive an informed consent and a demographic questionnaire. They are going to be a randomized double-blind trial, and we are going to do two groups. It's going to be the myo-inositol group, and the other one, the vitamin D3. So by week 12, the research is going to start. Group 1 is going to receive like 2,000 milligrams per day of myo-inositol, and the other group is going to receive 1,000 of vitamin D3 per day. They are going to receive a monitor, the one that is a continuous glucose monitor, and they have to download a dietary tracking app, which can be Chronometer or FitnessPal. And starting the study, all participants will be compensated with a total 400 of prepaid gift card. They are going to receive $100 at week 12. At week 23, they are going to receive another $100, and at the end of the study, they are going to receive $200. So They are going to do a blood work by week 12. They are going to measure the HbA1c. And for week 23, they are going to do the second HbA1c. They are going to receive another supplements. They are going to refill and check the adherence of the participants. And we are going to receive the continued CGM data. And also they are going to receive another $100, as I mentioned before. By week 24, we are going to do the OGTT test. And by the end of the study, by week 35, they are going to do the last HbA1c check, the last collection of data, and it's going to be the last day to have the supplements, and we are also going to give the rest of the compensation. This is the consent form that they are going to receive. I just attach it. That way you have a view of the content of the consent form. I also attach the demographic questionnaire. That way we can know what ethnicity has more prevalence to have GDM, and also which ethnicity has a reduction of this using the supplements. So the participants will be recruited visiting OBGYN clinics, local ones. I'm going to use flyers and brochures that describe the research to the clinics. And this study will be conducted in different clinics, in outpatient clinics in San Diego. And after the enrollment, participants in group 1 and group 2 will be receive their respective supplements, which will be refilled monthly, and participants will take them home and should be continued with the prenatal appointments through the research. If patients present hypoglycemia or hyperglycemia, they will communicate with the patient's primary physician and discuss the patient follow-up protocol with the research team. So this patient inclusion, the inclusion criteria is participants must have 12 weeks or less of gestation to start. They have to present a pre-pregnancy body mass index higher than 25 kilograms, which is overweight, or they have to be obese. They also need to have a PMOS, which is a polyendocrine metabolic ovarian syndrome, which used to be a PCOS. And the exclusion criteria will be if this patient had a previous GDM diagnosis, a pre-existing type 2 or type 1 diabetes, and also if participants present chronic disease like high blood pressure or another like a cardiovascular problems, they are not going to be part of this research. So the sample size was calculated using G-Power software. I use repeat measure within between interaction, and the effect size is 0.20 and alpha error probability of 0.05 and a statistical power of 0.85. The sample size will help me to detect any difference in glycemic outcomes between the supplements and the control groups. The second test will be a chi-square test to determine whether myo-inositol, yes or no, yields better results than vitamin D3 supplementation. And based on the G-Power results, a total sample of 32 participants is required for ANOVA. However, I'm planning to recruit 90 participants. That way, I'm going to avoid any conflict with the chi-square test. Chi-square has an effect size of 0.4 and a error probability of 0.05 and the statistical power of 90. and a difference of 3. So the data collected is going to include age, pre-pregnancy BMI, family history of diabetes, fasting blood glucose, and the results of the HbA1c, and also to monitor the glucose levels. As I mentioned before, the CGM is going to be used, and we are going to ask the participants to provide all the data in each monthly appointment with their doctors. And this data is going to be shared with the endocrinologist, the research personnel, and also their OB to check everything, and including all the demographic information, medical history, laboratory test results, and supplement log will be collected by the research personnel, and it will be discarded after 7 years. So to track their consume of the supplementation, we are going to provide like a log. That way participants can log all the supplements that they are taking. And we are going to ask them if they can give us access to the app, which can be Chronometer or FitnessPal. That way we can know how many vitamin D3 and myo-inositol is consumed in their diets. And also, if they don't have a food recording in the apps, we are going to do a 24 hours diet recall. That way we are not going to miss any data. And participants' information will be protected in accordance with HIPAA. And also, if the participants don't want to finish the research or they feel at risk, they can leave the research at any point. So data will be analyzed using this software, which is demographic analysis and population project system, where variables such as age, pre-pregnancy BMI, fasting glucose, and the results of the A1C will be summarized using the mean and maximum deviation, and categorical variables, including ethnicity and family history of diabetes, will be summarized using percentage. Continuous variables will be assessed using histograms, and potential outliers will be evaluated using box plots to determine whether they are the results of data or measurements errors. If any small amount of data is missing, is going to be using available observation, and if data is substantial or determined to be a non-random, appropriate statistical methods will be considered to the reduced potential bias. So the strengths of this study is to determine which supplement is more effective to reduce GDM. Also, the supplements are affordable and it helps high-risk patients. The limitation of the study is that the participants are only from San Diego area, and the results may affect if by the lifestyle factors, which is diet and exercise, and missing data from patients could affect results, can be missing appointments, not wearing the CGM, and constantly missing taking the supplement. So after the research concludes, the findings will be shared through multiple channels and will be presented at local hospitals such as Sharp, Scripps, and Kaiser in San Diego area. And also, this information can be shared using podcast channel focusing on nutrition, such as On Nutrition by Tara Schmidt, Health Matters by Christine, and also we can use YouTube channels such as Jay Shetty Podcast and Mayo Clinic Health Matters Podcast. And that's it for my presentation. Thank you so much.